So we're looking at workplace marijuana testing in a post-legalization era, and it's really interesting how the federal versus state laws shape employer policies. Even though many states have legalized its medicinal and even adult use, employers, especially in places like Texas, still have to stick to strict testing protocols.
Right, and that's because marijuana remains a Schedule I substance under federal law, isn't that so?
Exactly. And even in states like Oregon and Washington, where legalization is clear, employers have the right to enforce a drug-free workplace policy without making exceptions for personal or medical use.
But don't some folks argue that marijuana should be treated just like alcohol, where off-duty use isn't penalized?
Well, that argument definitely comes up. However, unlike alcohol, where impairment is relatively obvious and testable with breath tests, marijuana impairment is tricky. There's no, uncomplicated test that reliably shows if an employee is impaired at work.
So, an employee might actually appear sober, but still have elevated THC levels from off-duty use, right?
Precisely. The science behind THC blood tests is still evolving.
That makes it a real challenge for employers. But I'm a bit skeptical. Isn't it a bit harsh to maintain such stringent testing when off-duty use doesn't necessarily impair work performance?
I get that perspective, and it's a fair point.
Right.
But in many industries, especially safety-sensitive ones, even a momentary lapse due to impairment could have significant consequences.
True, safety does come first. And I suppose, legally speaking, companies just have to follow federal guidelines for compliance.
Exactly. Whether it's Texas or any other state where marijuana remains illegal federally, employers are advised to use regular drug testing to minimize risks and stay compliant with both state and federal laws. It's like trying to mix oil and water, Employers must navigate between accommodating state legalization and adhering to federal rules which still see marijuana as unacceptable in the workplace.
And what's interesting is that while some argue for treating marijuana like alcohol when testing, the impairment factor really sets it apart.
Yep, that's the crux. Alcohol impairment tests are straightforward, but for marijuana, since we can't accurately pin down in-the-moment impairment, employers err on the side of caution.
But it sounds like for optimal workplace safety and legal protection, regular, rigorous drug testing programs still make the most sense.
Maintaining a safe and compliant work environment means continuing to test and monitor, ensuring that safety-sensitive operations aren't compromised.
Absolutely. Employers need to be diligent because of the federal implications.